30 years ago, transplant surgeon Jay Vacanti and chemical engineer Robert Langer realized that to build an organ, cells also need a framework, a scaffold to guide their growth. The challenge was to engineer scaffold materials living tissue could grow on.
So this is a material that we call biorubber.
Biorubber, and you use the prefix bio because whatever is the material it will take to flesh or living cells.
That's right.
So why does the cell even care?
Because a lot of things could be toxic to a cell, or the cell wouldn't like their surface and wouldn't be able to grow on it.
Picky cells.
Cells are picky, and some are more picky than others.
But sculpting a scaffold out of the right material is only a start. To turn one into a living body part, an ear, for example, it must then be seeded with cells. A few weeks in an incubator allows those cells to multiply, covering the scaffold. Then comes a rather strange test. This is really creepy. I mean, mice are creepy enough, and this one has no hair and a human ear growing on its back.
Yes.
He doesn't seem to mind that he has an ear growing on his back.
No, he knows he's here for a bigger purpose. But this is a very, very important step in the science, because on the back of this animal, we're actually incubating and growing perfect cartilage in the shape of a human ear. And it's completely connected to the blood vessels, so that it's just like a native ear in a normal circumstance.
In the head of a person.
That's correct.
So when this finally gets implanted in a human, you don't expect rejection, as is so common with new body parts.
Exactly, because we're going to start with the patient's own cells. It'll make his own tissue, and therefore the body will accept it.
Within a year, Vacanti and Langer expect to be implanting their ears directly on the heads of soldiers wounded in Iraq and Afghanistan. But these will not be the first recipients of lab-grown body parts. Already, patients of other doctors have received blood vessels, skin, muscles, even bladders built the same way.
Removed from the donor's body, the heart is quickly connected to the device through the aorta.
This is seriously just one of the most amazing things I've ever seen, you guys. There is a heart beating right in front of me.
It continues to receive warm blood, as well as a proprietary formula of nutrients.
Conceivably, how long could you keep a heart beating on this?
If you can renew the
blood,
it can go as long as you would like.
Tamara Hayal, the VP of Clinical Development at Transmedics, showed me how the device allows clinicians to monitor the heart's rhythm and other vital signs every step of the way.
So this thing lets you know that everything is going okay?
Absolutely.
And what happens if something goes wrong?
You'll have detection here and alarms that are going on to tell you that you're out of range, and you can immediately control it. You can change pump flow, you can navigate into menus to change the settings to actually treat this heart. So you have a very comprehensive analysis of how this heart is behaving, and you have a chance to improve that behavior if needed and when needed.
So I have two questions for you. One, how fragile is the heart? And two, can I touch it?
One, it's not very fragile. Two, yes, you can touch it, but it's not the norm during clinical practice.
Okay, not the norm? You're going to make an
by all
exception?
means, you can touch it. This is a training heart today, so by all means, if you want to feel the ventricle pulsating, right side and left side, and you can feel the vessel itself, see the pressure in the vessel.
It's warm.
It's warm, it's beating, it's functioning. It's just functioning as if it's in your body.
Gosh.
And it's not just hearts which can be transported on this system.
这个孩子是个车祸，所以他不光耳朵没了，耳朵周围的皮肤血管全部毁掉了。
要酒精是吧？
所以他没有血管，皮肤也不好，就没办法用传统的方法造耳朵，所以我们才耳朵在这个胳膊上先预制了个耳朵。
好的，5个零。
对细节。要不你看我们今天用多少时间？吸多少时间？啊？多少时间？
The impact of air pollution on children's brain development and health. The small smoke particles from air pollution, or PM 2.5, are more than 25 times smaller than the width of a human hair. As air is inhaled, particles enter the body through the nose and mouth. Air passes through the respiratory airway and finally reaches the alveoli, tiny air sacs in the deepest part of the lung. The smallest of the particles that enter the lungs diffuse through the walls of the alveoli into the bloodstream, where they are transported to all organs of the body where they can affect normal function. Critical organs affected include the lungs, immune system, heart, and developing brain. The growth rate of the brain is highest around birth, but development continues throughout childhood and adolescence, playing an important role in a child's memory, attention span, emotional control, and social interaction. Once in a child's still developing brain, particulate matter damages brain cells. The result, impaired cognitive development and ability to learn that may have severe consequences for welfare and earning potential across the lifespan, and may accumulate, resulting in neurodegenerative disease later in life. In addition to harming the brain, exposure of the fetus to air pollution may increase the risk of other diseases across the lifespan, including stroke, pneumonia, ischemic heart disease, chronic obstructive pulmonary disease, lung cancer. Protect your children from air pollution. Stay inside when air pollution is high. If you have to go out, wear a filtering mask. Install window filters and air filters at home if possible. Consume food and drinks high in vitamin C, E, and omega-3 antioxidants.